I'm moderating this one. Andrew Clark, good to see everybody here today. Thank you so much for being a part of today and yesterday. Tremendous energy in the room, and I thank Daryl for all of that. Frankly, I mean, he brought it to a new level with building bridges this time. So, thank you so much. One thing that we've been talking about over the years, and we brought it in 2015, building bridges, when we had a presentation from the Vera Institute of Justice on the European American experience. And if you recall, that was a few folks from Colorado, from Georgia, and from a few other states that went over and took a look at the prison systems in Germany in particular. And they found that things worked vastly differently. And as those who have been a part of this and trying to reform and change this system in recognition that what we had was not working and not working well at all, especially if you reflect on the words from Easy Wayne, that shows firsthand how it wasn't working well. You realize that overseas things are done a little differently, and maybe we can learn something there. And so through our urging, Governor Malloy and Scott Semple went over to Germany. They took a look at the system there and brought some things back. They brought back the True Unit. They brought back just a different mentality and a belief in rehabilitation and a sense of what could be done differently. Now that didn't reflect in systems change. So it was in bits and pieces, but what we're going to talk about today is really system change, and just a few minutes of it. And this is what the white paper, Connecticut at the Crossroads, COVID-19, the state budget crisis, and the path toward decarceration, public safety, and community investment is about. We're in a watershed moment here. We are the first state in the country to cut 50. We're going to be talking about our prison closures later. Connecticut for 50 years, from 1930 to 1980, had only 3,000 individuals in prison. It wasn't until 1980 that we saw that exponential growth. And the question I think we should ask ourselves now is, what are we getting down to? Now that we've cut 50, what is the next phase? Are we going to get rid of all of them? What is our vision? Because we need a vision in order to move this forward. And so we're going to have a conversation today about what that potential vision could look like from an international perspective and a human rights perspective. And I'd like to bring on James Cavallaro for those who were able to watch the video yesterday, and we'll share that with participants after today's events. But Josh Peterson, his colleague there, put it together, and it talked a little bit about the paper. But we have now Jim in person. Jim, I met just actually this past year through a human rights consortium that we're a part of, and he has a tremendous background in international human rights. So Jim, why don't you tell us a little bit about yourself and about why it was important that Connecticut take a look at human rights in an international perspective per the white paper.
Thank you, Andrew. And first, let me say what a pleasure and a privilege it is to be in this conference, which is dynamic and engaging, really useful and worthwhile for me. And so a shout out to all of you, and Daryl and the DJ and everyone who's been putting this together. Just a few words. Andrew came to me through this consortium and said, you work, and what I do, I work in a university center. We're based at Wesleyan, and we engage students in working in human rights and social justice. My background's in human rights. For the past 20 odd years, I've documented conditions in prisons throughout the Americas, throughout the Western Hemisphere. I've been in a couple hundred prisons documenting conditions. And speaking with Andrew, a couple of things. One, we want to see what's going on in Connecticut. What are the trends? Where are we headed in terms of decarceration? And what else might we learn from human rights and other examples in the rest of the world? And we put together this paper. I don't really have enough time to go through what's in there and give you a couple of main ideas, but I put my email in the chat. The white paper, it's 100 pages. There's a shorter version. It's all available at humanrightsnetwork.org, humanrightsnetwork.org, and then you go to projects and it's Connecticut decarceration. but I'll say a few things about the paper. And then I wanted to ask Ifeoma Anyoku, who's here with us, who's one of the students who did the research on this work, about what she did and about what students are doing and about the energy on campus to transform our criminal justice system and to really engage with human rights. And so just a couple of big ideas that to put out there. First, from having been to a couple hundred prisons and detention centers throughout the Americas, I'm talking about Latin America, I'm talking about Mexico, Paraguay, Bolivia, Brazil. One of the things that I tell people, and people are shocked, is if I had to do hard time, I would rather, as bad as prisons are, the infrastructure, the physical condition in Latin America, I'd rather do time in Latin America than the United States. The conditions in the United States prisons are dreadful, and they're dreadful by international comparison. And we need to get out of our own space and look at other parts of the world to see what is possible. Because our system is terribly punitive and isolating and soul crushing in ways that don't happen with other deficiencies in other parts of the world. And then the other thing to emphasize is prison has to be an absolute last resort. It's not in this country. It's a first resort. It's got to be a last resort. We've got to continue decarceration. It's happening in Connecticut. We have to move much more aggressively. And second, prison has to be about rehabilitation. It cannot be about punishment. If we want to talk human rights, that's a key core human rights element. It's got to be about rehabilitation. It's got to be about job training. It's got to be about education. It cannot be punitive. And prison in the United States and in Connecticut, still mostly punitive. So with that, what we hope with the white paper is to give folks, you folks who are out making the arguments, talking to people, working with legislators, working in communities, trying to change this space. We're trying to provide elements from human rights standards and from comparative experience that you can use. So I put my email in the chat. I'm happy to talk to you individually, happy to exchange what we know, what we've learned from working on this in other parts of the world to the extent that's useful for you. We want to be a resource. That's our goal here. I'm happy to have made the connection with Andrew and Daryl. That was what we were trying to do. And then what I want to do quickly is invite Ify. Again, what we do is we work with students, put together student work, edit it, refine it, and then make it available in different contexts on different human rights situations in different parts of this country and around the world. Ifeoma Anyoku we have a summer program at Wesleyan, an intensive program. We had 170 applications from around the country. Ify's one of 11 students who was chosen. She's a great student. She's super smart, hardworking, and committed. She's a student. She's an undergraduate at Brown. And I wanted to ask her, what she did on this, but also I wanted her to talk about what the feel and the vibe is like on campus in different schools today about the criminal justice system and what kind of connections maybe we should be making more aggressively with all kinds of universities, not just CCSU, not just the folks who are represented here, Wesleyan, but others in the state of Connecticut, to get students and beyond, because if it's at Brown, she's in Rhode Island, to get students involved. So Ify, if you could sort of tell us a bit about what you did and then what the feel is like on campus on these issues.
Hi, thank you so much for having me. So as Jim said, my name is Ify, and this summer I helped work on researching and writing a white paper about prison conditions in Connecticut and potential paths forward. Some of you might have read it. If you haven't, I totally recommend it. I think it's pretty well researched. And it was largely contributed on by students, many of whom, if not all, actually voluntarily stepped forward and chose to help write this paper. Not all of us are even from Connecticut, nor were we all students in Connecticut, as you all know. But I think that that's just a testament to how passionate and how dedicated students are to decarceration. This is not just an issue for legislators or seasoned activists. A lot of students are super, super dedicated and passionate. And that shows, like, even on my campus, I'm constantly seeing people at Brown advocating and organizing in favor of decarceration. And that's because students understand and recognize how important systemic deconstruction and rebuilding is, and how bright the future can be if we dare to imagine it that way. Obviously, our paper is focused primarily on Connecticut, But one thing that I especially learned from researching is that it's not just constricted to Connecticut. This is a national issue. And so everything that we write about is nationally applicable. It's about shifting towards rehabilitation and departures from harsh punitive modes of discipline or education. And of course, that's so important to advocate for. Students are such an important tool to use. They are passionate and they are able to reach out to each other in ways that are not always easy for legislators, politicians, people who are not as connected to colleges, or just young people in general. They're able to advocate in their own spaces. And of course, as I said, they are so passionate. They are always fighting. They never stop. We're so energetic. And I definitely think that it's important to look towards them as people who can be pushing for a national shift towards human rights-based approaches to prisons and ethical pathways. Because, after all, as people say, the youth are the future, we are the future leaders. And I definitely think that we are vital in imagining these new futures that we talk about in the paper.
Thank you so much, Ify and James. And it's so heartening to hear that because, frankly, when I moved over to the legislature, over to Central Connecticut State, Daryl asked, what's your why? One of my whys was to try to get students more engaged in the direct work of policy change. And it's so encouraging to hear you say that. And it's so powerful because, in talking to Jim, you recognize over the years of working in academia, that's not necessarily how it's structured. That professors aren't necessarily incentivized to have students working on the ground in their particular states or on particular issues, because that's not necessarily what publication's about. But it's so heartening to see that happening. And I know we've been talking with James about the potential of our children with incarcerated parents, scholarship students here at Central becoming human rights advocates and doing some training there. So we're hoping for that to work out. I want to bring in Bill Dyson now, who everybody knows, because I know Bill is a teacher by trade and by passion, and just hearing that and hearing the work, and I know that you're not teaching this semester, but you have the value of students getting involved in the work, and especially in this particular work.
Hey, thank you, Andrew. Can you hear me?
Yep.
Okay, thank you very much. It's a pleasure for me to be here today. And you will find beyond this point, I have little to say because I just appreciate hearing what it is that other people have to say, and you do that best when you're listening and you're not talking. And so if you're not hearing from me, know that I'm out there somewhere listening to what it is that you have to say. I have a couple of things I wanted to bring to this conference, and it's one of the things that I think in a big way is lacking, and that is how do you impact that system that seeks to continue to foster what we know does not work. And now how do you impact that system? Well, you have to get to know it. You have to delve into it. You have to find allies within it, and obviously you have allies without, but you need to have allies within it, and people who see things are willing. They are willing to see things in a different light, in a different way. Now, what I brought today is an article that I would encourage all of you to read if you get a chance. And it's in the New York Times. It's Friday, February 19th. And they're talking about budget. Now, this stuff, to many, it can be so boring and so overwhelming. But it is what you have that fosters the system that we have in place today. And here is an opportunity that I see. This is New York Times, as I said, February 19th. And I'm going to read the part of it that I want you to listen to, and hopefully we can do something with it. Now, I'm starting at a paragraph in which this talks about the budget proposal that President Biden has. Now, let me read that portion that I want you to just listen to and tell me, what do you think the potential is for being able to be a part of that? So let me read this now. Mr. Biden recovery plan includes efforts to train a cohort of new public health workers. That's to train a cohort of new public health workers, and to fund the hiring, and now to fund the hiring of 100,000 full-time workers by the public health departments, and 100,000. Now, I don't know if any of you remember, you know, it's kind of pointing up my age, but I remember that number 100,000 about 20 years ago. And that number 100,000 was monies provided to towns to hire police. More than 20 years ago, to hire police. Now, what we are doing today is trying to undo that undertaking that took place 20 years ago. Now it shows up in the form of 100,000 for public health. 20 years ago, it was 100,000 for police. Today, it's 100,000 for public health. And the caution I throw out, and it's not necessarily a caution, but what I would have you do is, how do you impact the potential 100,000 for healthcare workers? How do you impact the cohort of healthcare workers? How does that apply to what it is that we're talking about here? And it applies in a big way, because part and parcel of what we do is trying to find people employment to be able to do some of the basic things in their lives and be able to get on with their lives. That's just one. Now, I don't mention here that, but I shall now. I don't mention the green jobs. Green jobs is an element here, and the other part that I need to mention here is that there is this notion that this country is going to get engaged in doing something monumental about it, the infrastructure. Those are workers. And so what we don't have is a system by which we engage in making sure that we are part of that undertaking that's going to take place here. We don't have that. We don't have that. Because who's going to produce the 100,000 cohort healthcare workers? Who can provide the training for that group of people? Who's going to make sure that people who are unemployed are able to be a part of this? How does all this take place? Who here among us are going to engage in the cohort for healthcare workers, the creation of 100,000 jobs, the infrastructure, the impacting the system? What is it that we're going to use to make sure that we have an impact upon that? And that's the thing that I think that we need to do some concentrating on. Yes, Andrew, you about to say something?
Yeah, I was just going to say thanks, because, you know, what Jim talked about in terms of how, you know, folks are treated in Latin America and other places in the human rights perspective, and bringing academia and students into this work is I see it not dissimilar to what you're talking about, because we're talking about systems change, and systems change requires monumental shifts in how we do things. So like you're saying, when they funded in the Clinton crime bill, the 100,000 police, we saw system change. And what you're saying here is we have an opportunity for system change, but how is that going to happen? Who's going to take the lead and make sure we go in that direction? I want to bring in Elin here, because Elin Schie is from Norway. Folks may recognize her. I just put in the chat. We had in April, when we started doing this virtual thing, and we were gearing up for reentry month, We brought Elin on, and folks can remember her. She works in the prison in Norway, and we talked about the differences between Connecticut and Norway. And one of the things that really struck me and about how system change is different there. And when you talk about different, you're talking about people, recidivism rates being at the 20% rather than the 75 or 80%. Much fewer proportionally people in prison, a tremendous amount of diversion, a public health system that works, things like that. And when you have that, I think it's important to recognize the reason why that exists is because they take a look at the justice system differently. There's a way of looking at it where prisons are viewed, the punishment is viewed as the taking away of liberty. And it's not viewed as the justice system being a perpetual form of punishment, just beating people down into submission and certain groups of people. And Elin, I'd love to hear your thoughts on your viewpoint towards your work, how Norway views your criminal justice system, and also importantly, how you partner with your outside entities like the healthcare system to ensure that individuals have an individual level of care in the system.
Thank you for having me back. Yes, we have some principles for starters. Of the humanistic human view is always the basic in the thoughts, and then we have the principle of equal treatment and the normality, because like you said, the sentence taken away there is that taken away from the normal things outside is a sentence. We are not going to punish them more, but in the prison, we are leading them towards their new life after the sentence. So that's what we work with from day one. Normally, not every. It depends on how long the sentence is. But normally we start right away to make a plan on what the sentence will be and what the time in prison will be like. And that's you have and we have the joint respect for each other. The prison officers are working with the prisoners all the time during the whole day, and they're just at our prison. They're just locked up during nighttime, from 8:30 in the evening till 7:30 in the morning. Then everything is locked down. During the day, we are doing things together with the inmates and the prisoners. When the things we do differently from that I understand from you is we have the healthcare system. The prison don't have their own. We have the normal. We use the normal outside the healthcare system. We take them out if they have to go to the hospital. We take them out to the hospital. We bring them there for operations and checkups, and we also have a couple, 1-2 times a week. We have this prison doctor for small things, just checkups and small things, and we have nurses also. But we use the normal health things outside. Yeah.
And we're not going to be able to, unfortunately, because we started a little bit late and we got the next panel coming up, be able to explore a ton. But, you know, I wanted to invite you back just so people could say hi to you again. We've been so appreciative of the connection, and just to recognize another force in play to help us rethink how we do things. And we have partners overseas, and I can tell you with the Human Rights Consortium from Germany as well, that are very willing to help us rethink this, help us rethink the systems change. And so I just want to thank you all for being a part of this. I would have loved to kept going for an even longer conversation, but you know, we're going to go to the next panel. But thank you, Elin. You know, you took time in your day. You have every time, even with a little bit of notice. And we thank you that. Thank you, Jim, and thank you, Ify and Bill. And we'll be hearing from others later. And I'll kick it back to Daryl and thank you all. And hopefully people got a sense of a little bit of change that we can do to really keep pushing in the right direction here. Thank you so much.